Today is a surgery day for me. I only have one surgery. I am doing a breast reduction. So I'm doing a breast reduction on a patient who has already had one. People often ask me in the comments that if this is possible, and yes, it certainly is. So if you've had a prior breast reduction, you can indeed have a breast reduction again, but there's a few things to think about. So first of all, how far out is it from your first breast reduction? So if it's under 5 years, we as the surgeon need to be a bit more careful with how we do the breast reduction. So we need to be more respectful to the technique of the original surgeon, because we want to make sure that the tissue left behind has adequate blood supply or adequate food. Now, if you're over 5 years out, we can really do the breast reduction in any way that we like, whatever we think will look best. So it's important to know the timing. Now, the incision is also important. So if you've already had an anchor pattern incision, we really can't redo an anchor pattern reduction with a vertical. You already have that incision anyway, so there's not a big benefit to it, but I have patients often ask me in their DMs if they can have a lollipop incision the second time around, and it's pretty difficult to get a good shape when you already have that anchor pattern. So there's really two main reasons why people have repeat reduction. So it's either someone whose breast grew back, and there's about a 5% chance of that, more common if you're young. And the other population is people who just couldn't get small enough the first time around because of the limitations of the type of surgery they had. So they're coming back to get the size that they wanted in the first place.